Hi, I'm Dr. Nidhi Agrawal, consultant obstetrics and gynecology, practicing at Cloudnine, Patparganj, East Delhi, and Noida. The modalities of anesthesia commonly used in cesarean section, they are, one can do a spinal anesthesia. That's the commonest anesthesia used during a cesarean section, wherein the anesthetist puts the required medicine and you have a numbness in the area beneath your navel. So during the surgery, the advantages are patient is conscious and mother is able to hear the baby is crying as soon as the baby is delivered. The mother can keep talking to the anesthetist, the doctor, and she feels more comfortable because she is all awake and aware. And in this case, also the advantage is that surgery is pain-free, and this anesthesia gradually turns into analgesia, and the patient has a pain relief for longer period of time even after surgery. So the requirement for IV painkillers is reduced for the initial 6 to 8 hours, and gradually there is a resumption of leg movements, the movements at the level of ankle, the knees. Gradually patient is able to move that in the post-op period. The disadvantages would be that this patient would require catheterization because she would not be able to get up and go to the washroom, use loo. So we put in a urinary catheter in place, which can be removed the next day once the anesthesia effect wears off and she can get up and go. The other type of anesthesia is general anesthesia, wherein the patient is put to deep sleep. General anesthesia we do not prefer in pregnancy, because the gases, the medicines they used in general anesthesia can affect the baby also. There are certain indications for general anesthesia because they can be done faster. So we only use it when, especially in cases of abruption or this acute fetal distress, wherein we do not have much time to do a positioning for spinal and then the effect of the spinal to come. We do not have that much time to wait. The things go side by side. The anesthesia is being given, the patient is being prepared, and the baby has to be delivered very quickly. So there, the advantages is very fast. The anxious patient sometimes request for it that we do not want to know anything, we just want to be put to sleep. But the disadvantage is, once patient is out of general anesthesia, she would require a lot of pain relief medications. And here she can go and pass urine. There is no problem with the bladder bowel thing. So these are the two anesthesia modalities commonly used. Sometimes epidural is also used, but that's very less commonly used. If we talk about the incisions of cesarean section, in earlier times, vertical incisions were used. Nowadays, we use a modified Phanensteil incision, which can also be called a bikini cut incision because it is not seen in any sort of dresses. And the advantage of Phanensteil is not only cosmetic, pain is very less in these incisions. The healing is excellent in these incisions, and the risk of hernia is very less. Vertical incisions nowadays we use when we have to do a classical cesarean section. Classical means when we give incision on the upper part of uterus. So we cannot approach. So in those cases where there is morbidly adherent placenta, placenta accreta, these cases we give a vertical incision wherein the pain is more, the time to recovery is more, and the risk of hernia is more.